Hi, my name is Brian Caulfield. I'm a professor of physiotherapy here in University College Dublin and principal investigator in the Insight Centre for Data Analytics. What I'd like to speak to you about today is a European Industrial Doctorate Programme called CATCH, which is short for Cancer Activating Technologies for Connected Health. And let me first explain the story behind CATCH, or the rationale for CATCH. CATCH brings together eight talented PhD students from different parts of the world to work in Ireland, Spain and Denmark on the story of how we can bring technology to bear on some of the problems that are faced by people who have undergone treatment for cancer. And if we think about cancer, cancer is obviously, in societal terms, one of the major scourges of the last 100 years. There's not a person in this world who has not in some way, through a family member or through a personal acquaintance, has not been touched by cancer, or even themselves. And when I think back to my kind of relationship with cancer, and when I was a young person, listening to my parents speak about cancer, it was such a big thing, and it was seen as a death sentence, that people often in this country in particular didn't even use the word cancer. I remember my mother and father used to, when they were talking about somebody who had contracted some form of cancer, they would not use the word. They would instead say, "Oh, so and so has got the big C." And so that's how big an issue or big a problem it was seen to be, is that you couldn't even say the word. So thankfully, with advances in personalized medicine and surgical techniques, pharmacological therapy, we now have we have changed our relationship with cancer. And cancer, in a lot of forms these days, is seen as a very treatable disease. We're able to diagnose it an awful lot earlier. We have really good screening programs to catch people earlier, and to implement really, really good advanced therapies that can completely cure a person of cancer in a lot of cases. So cancer and our relationship with it is undergoing a transition, and it's gone from being seen as an almost fatal disease, or a terminal illness, to being something that can be viewed in a lot of cases as a chronic disease. And this is wonderful. This is absolutely wonderful. But this has created in itself a different type of issue that the healthcare system needs to address, because now that we're seeing a lot of people come through successful cancer treatment and coming to the other side, we now have to consider how we reintegrate those people back into their normal daily lives. So cancer rehabilitation has become a major area in healthcare, because there's so many patients who are coming through aggressive either surgical or chemotherapy or radiological therapies, and there's that has an enormous toll on their bodies. So when they come out the other side, they often have severe fatigue symptoms, loss of body mass, and in particular loss of lean body mass, and a condition known as cachexia, where they have a muscle bed which is in a lot of respects very similar to sarcopenia, which you see in the aging population. So as I said, we've started to see this cancer rehabilitation growing, and the popularity of it and the evidence base for cancer rehabilitation is growing ever stronger. And I am a physiotherapist, and what particularly interests me is exercise-based physical rehabilitation. And in that regard, we face a lot of challenges in trying to implement cardiovascular exercise or targeted strengthening and muscle re-education exercise in patients with cancer. So as a physiotherapist, I am particularly interested in exercise-based physical rehabilitation to improve the physical functioning of the patient. But equally important is the the mental health of the patient. So we need really good, comprehensive cancer rehabilitation programs. And as I've said, in the last 10 to 15 years, we're seeing an enormous evidence base emerging, which is showing that, active, particularly exercise-based cancer rehabilitation programs for patients who have come through aggressive cancer treatments are working extraordinarily well. And we can consider them as being successful on a couple of different levels. One, successful on the level of maximizing people's functional potential and bringing people back to the lives they want to live. But secondly, there is emerging evidence of a secondary protective effect in terms of reducing recurrence rates of cancer in patients, which is a fantastic outcome. But, and there's a big but, implementing physical rehabilitation in a patient who is severely deconditioned, prone to extreme fatigue at the mere thought of exercise, and also is dealing with the psychological and the mental consequences of having come through a very, very significant illness and a very difficult treatment process, is very, very difficult. So that's why we have put CATCH in place, because in CATCH we are trying to understand how the various technology developments that we have seen in sensor technology and actuator technology over the last number of years can be brought to bear on the rehabilitation journey for the cancer patient or the cancer survivor. Now, just looking at the technologies, I should say CATCH is an truly interdisciplinary project. We are bringing together people from different scientific backgrounds and from different sectoral backgrounds. We have people coming from industry, from academia, and from clinical backgrounds to try and understand how we can advance the use of these technologies, and we can develop specific technologies for cancer patients. But when we bring technology to bear on an unmet clinical need, the first thing we need to do is we need to understand that unmet clinical need, and we need to understand the journey of the person at the centre of it, the journey of the patient, understand the life patterns and the challenges and the barriers that are facing that patient at the centre of the process. So for that reason, CATCH starts with 3 PhDs who are looking primarily at the problems faced by the cancer patient and the journeys followed by the cancer patient. So we have 3 PhDs projects that are looking at understanding the problem. We then have a further 3 PhD students who are looking at specific aspects of technology intervention in cancer rehabilitation. So we have one who is looking at largely cardiovascular based exercise implementation that is leveraging gamification technology. We have another who is looking at implementation of cardiovascular and strengthening exercise using neuromuscular electrical stimulation platforms. And we have another who is looking at the use of sensor technology and mobile platforms providing real-time feedback and guidance for patients who are doing targeted muscle strengthening exercises. So we have these 3 different technology interventions that we are trying to advance. And then beyond that, we have a further 2 PhDs who are looking at the transition of these technologies into the marketplace, understanding how, if we do go from fully understanding the patient to developing a technology that meets their need, now how do we make that a sustainable solution that has traction in the marketplace and can actually benefit the lives of patients rather than being an interesting academic project. So, as I said, we have some really excellent partners in this project. We have Salumedia, a software company from Spain that specialises in gamification technologies. We have SDU in Denmark, who are an excellent academic business school. We have Oncoinvance in Spain and Beacon in Ireland, who are 2 excellent clinical facilities that have cancer therapy programs and cancer rehabilitation programs. And we have ourselves in University College Dublin, who are coordinating the project and hosting some of the PhDs. So that's the Catch programme. You are going to hear from the individual researchers. I really hope you enjoy listening to them speak about their specific projects and the challenges they're taking on. What I hope you kind of got from this few minutes of me speaking is, number one, recognising that transition in our relationship with cancer from terminal illness to chronic disease. Also recognising that there are new unmet clinical needs being brought about by our success in treating cancer. And that means that we need to drive very, very effective rehabilitation programs, and technology can potentially ease the pathway through that rehabilitation journey for patients. And in Catch, we're trying to understand how we can really integrate technology into that journey. Thank you.